We're going to talk about the complete prophy, and I get asked quite a bit on how long should it take, and what are the steps, and how do you do it, and so we're gonna talk about that a little bit. Now, this is certainly something that can vary, and you can certainly adapt this to your practice as needed. I've got several steps listed in here, and you can certainly rearrange these, or whatever's easier for you, but that all of these steps should be incorporated into a complete prophylaxis. And normally, we years ago would anesthetize a patient, clean the teeth, polish, and wake that patient up. And you will find that as you increase your dentistry service by including full mouth radiographs, it's going to be very rare that you're going to have a patient that's all you're going to do. When you're taking radiographs on a pretty regular basis, you're going to find pathology. We know that 85% of our patients over the age of 3 statistically have some degree of periodontal disease or other pathology. And so that's going to need treatment. And so the timing of your prophies are probably going to change a little bit as you institute these new protocols. So I know we've all done the whole dental month, discount, and let's book as many as we can, and we get them in and we anesthetize and we clean the crowns and we recover. And unfortunately, this is an incomplete prophylaxis. It is a cleaning, but we have to kind of reapproach dentistry, and waking them up, unfortunately, is not doing the patient any good at all. It's a purely cosmetic procedure. And we've all seen this when we have those really heavy, thick calculus dogs. We get them in, we anesthetize them, we clean the tartar off, and the tooth underneath, nice and white and clean, and oh, it looks wonderful. The problem is all of that pathology lies beneath the gum line. It's not on the crown, not unless you've got a fracture. But periodontal disease, which is primarily what we're going to see in these patients, is all above the gum line. And so if all we're doing is cleaning the crowns and not addressing what's going on above the gum line, we're missing a whole boat, and we need to make sure that we're catching this, treating early to prevent tooth loss. That's our goal. That's our goal, is to prevent suffering in our patients, prevent pain, prevent tooth loss. And we can't do that unless we find that pathology and treat it. So a simple cleaning is probably not going to be the norm anymore in your practice as you increase your knowledge and increase your skill set and increase your services that you're providing in that dental service. So that being said, let's talk about what a typical prophy, if there is no pathology that's found, what kind of time frame we're looking at, and this is going to include, of course, the initial anesthesia. We're going to hook this patient up to monitors. We're going to take full mouth radiographs. We're going to do the complete cleaning and polish, dental charting, all of that. We're looking at anywhere from 35 to 45 minutes in a typical medium-sized dog, average, about. Now, depending on where you are in your practice, if it takes you a little bit longer, if it takes you a little bit less, that's okay, as long as we're covering all those. But those, like I said, those types of cases where we're just cleaning and recovering are going to be pretty rare.